So reconvening the House Early Childhood Defiance and Policy Division. And we do have, I suppose, continue to have a quorum. So we've got Representative Bahner up front, and we're moving to member questions now. And Representative Heintzman, I know that you had some. We'll start with you and then move to anybody else that we want. So Representative Heintzman.
So thank you, Mr. Chair. Launching right in.
Please do.
Representative Bahner, just we're looking at a couple of different things here, and definitions is part of it. But I think I'll start with a question, and I'm hoping you have both the amended version and the original. If that's possible. I saw that there was some changes in the original compared to the amended version, and I just wanted to know why. And so I'd be specifically looking at the original version in 1.13. And what I see missing in the DE is a line there that specifically mentions that the programs, I think, are targeted culturally or ethnically, and that's no longer in the language in the amended version, and I was just wondering why that isn't being included.
Representative Bahner, it looks like you've got a friend up there as well, so it looks like maybe she will. So if you can identify yourself for the record, and then please proceed.
All right. Mr. Chair, members of the committee, my name is Laura LaCroix DeLune, and I am the coordinator for the Minnesota Coalition for Targeted Home Visiting. Representative, to your question specifically, we worked with the Department of Health, we worked with the county and tribal health departments across the state and some of our model programs to find language that was consistently found in statute. And the reference that we had formerly on line 1.3, as you mentioned, it was difficult to have definitions around that and implement consistently across the state. And so we opted to utilize language that was already provided in statute and agreed upon language.
And Ms. LaCroix, you're referencing line 1.13, I think, rather than line 1.3.
In the original bill.
In the original bill, 1.13. Okay, Representative Heintzman.
Yes, thank you.
Thank you, Mr. Chair. No, I appreciate that clarification. I didn't understand why that might have been moved and changed. So I might transition now, if it's okay, to another question.
Representative Heintzman, it sounds like Ms. LaCroix DeLune may have something to add on that, if that's okay with you,
Mr. Chair and Representative, sorry, one more clarification. Part of what we were afforded the opportunity with this bill and with this delete all is we had a minimum amount of language that was in rider, and now that we're codifying it, it allowed us to have the opportunity to define these things. So you'll see some of the original language in House File 1226. We tried to bring as much of the original language forward from the rider, but as we worked with research and worked with the department, we realized we had a real opportunity to just get it right. Sometimes the language is compromised over time in a rider, and that's what we had previously in rider language.
Representative Heintzman.
Thank you, Mr. Chair. I'll be moving now to the DE since we got that cleared up. And some of the definitions, and I'll start in line 1.16, trying to figure out here what exactly is, and I know that we had a presentation, Mr. Chair, earlier on some of this, so we may be having to kind of draw back on some of what we may have heard, but evidence-based home visiting program, how are we defining evidence-based home?
Ms. LaCroix DeLune or Representative Bahner.
Mr. Chair, Representative, the language here, what we are trying to do is be consistent with the language that our Department of Health staff, Don Reckinger, mentioned earlier today. So these definitions are consistent with what HRSA uses to help identify evidence-based programs. So we wanted to bring that forward and codify that as well.
Representative Heintzman.
Thank you, Mr. Chair. So I guess what I'm trying to figure out is who makes the determination that a program is evidence-based or evidence-informed?
Ms. LaCroix DeLune.
Yeah, Mr. Chair, Representative. In this case, what we are referring to is the part of the presentation you heard this morning where Ms. Reckinger mentioned there were 14 to 17 different evidence-based programs. Again, we're using those that have been defined by HRSA as evidence-based. There are 6 that have been identified in Minnesota. So unjust by moving this language forward, we would say those 6 that are being supported through the Department of Health would meet that criteria.
Representative Heitzman.
Thank you, Mr. Chair. So the question is coming up, of course, because, and I'm sure some members, of course, heard the testimony, and you probably did as well. How is information being protected? And we're trying to make absolutely sure as best we can. And there's still, I think, a lot of questions as to determining that there's no possible way to work backwards through a third-party system to determine who's who. And to me, that there's maybe not an answer that is going to satisfy that specific question at this point, but I do want to bring it up in public testimony. That's part of the reason that I brought us to this. Sorry, Mr. Chair. That
No problem, Mr.
situation. But of course, privacy is a very sensitive issue, and that's why we're probably still here talking about this. And so I would add to that: is there any place, and you had already kind of referenced it, I think, but is there any place you can point directly to where these evidence-based definitions were drawn from in this bill?
And Ms. LaCroix DeLuna, I know it looked like Representative Bahner had wanted to say something earlier too, but why don't we get an answer to Representative Heitz's question? Yes, Ms. LaCroix DeLuna.
Yeah, okay, Mr. Chair, Representative. The evidence-based definition comes from, follows what HRSA uses, so the federal government, how they define the use of the federally funded evidence-based program. So we were trying to mirror that so we would be consistent here in Minnesota.
And Representative Bahner, it looked like you had something to say before.
It can wait.
Okay, Representative Bahner. Representative Heitzman, you still have the floor.
I appreciate that, Mr.
Yeah.
Chair. I will go ahead and allow another member to ask
Oh,
questions.
okay, and
My hand is up.
no problem. And I actually want to say, as long as you'd said that before, that that members absolutely should have the time to ask questions. So I don't mind at all us coming back. I'm apologetic to everybody else for just the way the timing worked out. But no, you deserve to have questions answered, and that's what we're doing here now. Representative Pryor.
Thank you, Mr. Chair. And so I was thinking back to the testimony this morning and what we're talking about evidence-based programs. And so, and because we were all there, it's a quiz, it seems like when they're talking about they're saying these programs qualify for the grants because they are evidence-based. But I think what that meant is that the research has been done to show that they, that there is, that they do demonstrate improvements in the ways that we wanted to see them demonstrate improvements. So in a sense, when we're talking about evidence-based, that's a past tense thing. That's what I understand from when they were talking about evidence programs in the presentation this morning.
Maybe we'll have Ms. LaCroix, if you've got anything you want to add or correct or adjust to how Representative Pryor characterized that. Looks like she.
Yeah, Mr. Chair and Representative, I think that's fair to say. I mean, these are rigorously evaluated programs that have been proven time over and over again. So, I mean, I would say these are kind of like the gold star standard because they've been replicated in different communities across the country. And each of these, I will just say about the privacy concern, each of these programs, I just want to really be clear, they are all voluntary, and that parents at any point in time can choose to opt out of a program and leave a program, as well as they can, decide which parts of the data that's being collected is collected. So we work really hard, whether the home visitor is a public health nurse or a social worker or a paraprofessional, we work really hard to allow families to have as much control over that process because so much of the home visiting work happens because you have a strong relationship with that person. And if you would breach their trust on data, you would lose them as a client.
Representative Morrison.
Thank you, Mr. Chair. Either to the author or the testifier, and I apologize for walking in late, but I'm wondering if you could explain what the link between using evidence-based practice and concerns about privacy might be.
Ms. LaCroix DeLune, Representative Bahner.
I'm not sure if I understand the question.
We could ask Representative Morrison to
Well,
Can you clarify
it.
just a little bit more?
I'm not following, I'm not following Representative Heinzman's train of thought of what using evidence-based practices in these home visiting programs, how that potentially creates privacy issues.
And it may be that that's a question that's directed to Representative Heinzman, perhaps, to clarify his own question, if Representative Bonner, if...
The short answer is there is no link.
well, let's let Representative Heinzman clarify his own question.
I don't want to create a,
Yeah, just make sure we understand, or if there's, Representative Heinzman, anything that you want to...
Thank you, Mr. Chair.
No problem.
And I don't know if folks are looking directly at the language here, but we see on line 1.6, definition of evidence-based home visiting program, which means a program that is based in a clear, consistent program. Go moving on to line 1.7, or model, and then it goes on further. And I think that the big concern is when we go and we drop down to line 1.17, evidence-informed home visiting program means a program that has data or evidence demonstrating a program's effectiveness. Well, as we were hearing in testimony earlier, because there was a number of folks that testified and shared their concern as to how a third party is going to be managing data. The first-hand folks are going to be, as I'm understanding it, looking at this evidence-based information, which is, I think, very direct, whereas where we're looking at informed evidence, and the testifier can correct me if I'm wrong, but informed evidence is going to be, in most cases, my understanding, a third party that is going to be looking at this information and making determinations without knowing necessarily who, and identifying individual students, but still being able to generate information that's useful to the legislature. And here again, like I said, if the testifier would like to clarify, that's fine, but that's my understanding.
Maybe we'll have Ms. LaCroix-DeLune, why don't you provide some, shed some light on this for us?
Sure, Mr. Chair, Representative, thank you for clarifying that. There may just be some misunderstanding about what this language means here. So to clarify, evidence-informed means that a program, it uses the evidence in their program design. So they build their program design based on evidence from these models, the evidence-based models on 1.6. But they haven't gone through the rigor of being connected to a university, so they can't call themselves a model or an evidence-based program. So they have, so they have outcomes showing that they are working with families, working with kids, some of the same things like developmental outcomes for the child or for the mother around maternal depression. All of that data is collected and de-identified when we talk about reporting back what we know. So you are, because this crosses over, right? So it's health protected data. The data that we are interested in generally as a state is how it's aggregated together. So we go over and above to try to protect that individual level data, but it's really the de-identified aggregated data that helps us make policy decisions. So I think the point you're raising is valid because we want to protect people's data. And I will just say all the programs that we work with, whether it's local public health or nonprofits or tribal health, they follow all of those statutes. I mean, that would be a responsibility or they would lose funding. And more importantly, they lose the trust of the families they're trying to serve, right? So we work really hard to honor that relationship. But the evidence-informed data, we're talking about aggregate level data here. We're not talking about the individual data here.
Representative Heinzman.
I think what I heard was that I had that basically right. So I'm just to confirm.
Ms. LaCroix-DeLune.
Mr. Chair, I'm sorry, I didn't hear what you just said.
He was saying that he had this, that it's heard from you that was basically right.
That's what I'm hearing from you.
Ms. LaCroix-DeLune.
That you're,
That Ms. LaCroix-DeLune, that you had what Representative Heinzman said as being basically correct.
No.
I don't,
I'm
Mr.
asking-
Chair, Representative, I don't
Sorry.
think so.
Actually, so
Representative Bahner.
Representative Heinzman, hopefully I can shed some light here a little bit. I think the assumption was made that this data was being shared with third parties, which it is not. You are not sharing identified data. Personal data, or PHI or PII, personal health information or personal identifiable information cannot be shared under HIPAA privacy laws. So when you're talking about trying to establish whether something is effective, you can share data that is de-identified. So what that means, for those of you in the room who are not familiar with this, is so, for example, you could have a data set and you can pass on specific pieces of information. So, for example, if I want to know if something's effective, I might want to know, I want to know how well 5-year-olds do with a certain program. So I might pass on a unique identifier. I might pass on the age of the child. I might pass on information on the specific program that they're involved in, or a specific marker that shows the results of that program. But we would not be supplying specific identifiable information, such as we would not be passing on information like your address. We would not be passing on information such as a child's name. You would not pass on anything that could identify that child specifically. So you will know that a 5-year-old participated in the program, and you will know perhaps the dates they participated in a program, and you can see other markers or results-based information from that program, but you will have no idea or way to trace who that individual child is, or trace them back to their parents or where they live, or any of that type of information. That's how de-identified data works.
Representative Heinzman.
Thank you, Mr. Chair.
Yeah.
No, those are things I already knew. The issue is, and this is what we heard in testimony this morning, and part of the reason that I had questions beyond what we had already had an opportunity to ask, was that there are folks that believe that this information that is being, that is evidence informed, which is being used to generate usable data for folks that might be in a third-party situation, could use to still identify individuals after that point. Now, that may not be the case, but I was wanting to try and get some more clarification to understand, because when we looked at the original language that we transitioned away from, these definitions weren't there. That's why I was trying to figure out where those definitions came from and maybe why and who generated those. It doesn't mean that we're necessarily wrong, but I wanted to make that clarification, because if a third party could go back through de-identified information and determine who, based on dates and other information that was included, who a student was, and that information doesn't go away. That lasts forever and ever, and I think it's an important issue to discuss further.
Ms. LaCroix-DeLune, you want to comment on Representative Heinzman's concerns at all?
Mr. Chair, Representative, I believe your concerns are addressed in all the agreements that we have with families. But to your question about who helped create these definitions, there's the definitions were created together through the Minnesota Department of Health, the local public health association, the coalition that I support, and then some of the model programs who operate here in Minnesota. So several organizations and state agencies who do this work with home visitors across the state were involved in creating these definitions.
Representative Heinzman, are you moved a couple
I
folks?
appreciate that,
Hey, no,
Mr. Chair, and I guess that would be my final comment, so to speak, on that issue. I wish that the state and federal government had an absolutely perfect, flawless record on this issue, but of course there are examples where that hasn't been the case, and so I think that's just an important part of this discussion.
And thank you for raising it, Representative Heinzman. And we've got a couple other folks, and it may be that provokes more, and feel free to dive in at that point. So Representative Morrison, you're next up.
Thank you, Mr. Chair. I just wanted to thank Representative Bahner for bringing this bill forward and expanding this program for our really vulnerable parents and children to help get them off to a great start. So thank you so much for your work.
Representative Katiza Watun.
Thank you, Mr. Chair. I just wanted to clarify something I think I heard from Mrs. Reckinger this morning, and then again from you, Mrs. LaCroix-DeLune, just earlier. So not only are these programs completely voluntary, so even if a doctor were to recommend that a child participate in this program or that a mother receive home visiting from someone at the hospital, someone through a different community organization, that family has the choice to say, no thanks, I appreciate the information, but I'm going to pass.
Mr. Chair.
Ms. LaCroix-Dillon.
That's correct.
Great,
That's
thank you.
correct.
Thank you.
So if they began the program and decided to no longer continue, they could opt out of the program at any point, correct?
Ms.
Mr.
LaCroix-Dillon.
Chair, Representative, yes, that's
Thank you.
correct.
And they also, if they're concerned about data privacy, could say, I actually don't want any of my data shared, or you can share these pieces of my data. So they ultimately have whole control over what could be used in the program as de-identifiable data. Is that correct?
Ms. LaCroix-Dillon.
Mr. Chair, Representative, they have control over what data is collected, yes, absolutely. And at any point, they could even ask to see what data is collected.
Okay, Representative Cortese-Wattoon. I should say, by the way, the two of you have very tongue twister names that I'm struggling with. Cortese-Wattoon, LaCroix-Dillon. Anyway, Representative Cortese-Wattoon.
Those
I'm
were
hanging on for dear life.
Thank you, Mr. Chair. Those were just really important points of clarity. So I just wanted to make sure that families do have that control and they can make those decisions for themselves at any given point, participating in the program or not, sharing the data or not.
Okay,
Thank you.
good. And any further comment on that, Representative, or Ms. LaCroix-Dillon, Representative Cortese-Wattoon's points at all?
Yeah, Mr.
like
Chair.
you agree with them, I guess?
Representative, that is correct.
Okay, thank you. Any other questions from members? I guess we'd closed public testimony before, we had that. And so, and I want to echo Representative Morrison's point that of thanks to Representative Bahner and to Ms. LaCroix-Dillon, who's worked on this issue for a long time. Home visiting is just proven itself, I'd say proven both through evidence-based programs, evidence-informed programs, to have an amazing impact on families. And I know these proposals have the support of the Minnesota Catholic Conference, and I think they have, you've got Republican support authors in the Senate, I believe, and so just some pretty amazing programs. So unless there's anything else, with that, I will lay this bill over for possible, oh, pardon me, there is somebody, Representative, oh, okay, we're holding off, okay. Over for possible inclusion in HHS division report, and then with that, we are adjourned. Oh, pardon me.
That's what I was-
I'm missing something, okay, sorry, yes.
No,
Okay.
I did want to bring up something
please.
from this morning. That
Oh, yeah.
I want to quickly, briefly touch on.
Please.
Members might have noticed that we didn't move the minutes this morning, and Mr. Chair, I just wanted to confirm, I think folks have probably had an opportunity to kind of develop a plan as to how to work on an issue that I think might have been a part of the minutes that we were potentially going to move forward with. And I wanted to see if we did have a plan, and I guess I'm expecting that we're going to be probably hearing some bills again. Is that?
We will be hearing, yes, we will be hearing bills again, I mean, at future meetings.
Well, the bills-
This won't be the last one.
The bills that we did hear, as there was some technical issues with how we progressed.
Thank you, Representative Heinzman. So, and what you're referring to is that in a draft of the minutes, well, so at our meeting on Tuesday, we had moved a bill prior to having a quorum. Then we had a quorum and then had an amendment added. We have checked with House Research. I was going to talk with you all afterwards about this, but and we've been told that the action of adding the amendment after the quorum essentially is a technical error, and to confirm that what should have happened is that we have the quorum, we then move after having the quorum. But we do have information from House Research saying that that should be fine. 1.2 is that bill was later for possible inclusion, so language would be reappearing in a division report. So I'm happy to talk about that offline. It may be that what we do want to do is to bring that back up. It seems like it may not be necessary, in fact, but I'm happy to talk about it. I did want to make sure the minutes were accurately reflecting those steps, and that's why we weren't going to address those minutes today. But Representative Heinzman, does that address your concern, or?
To an extent, it does, Mr. Chair.
Okay.
I do think that in light of Mason's 500, 502, and 505.
Oh, my goodness. I guess you represent Heinzman. Oh, that's
that we
good.
probably should be looking at a technical fix that would involve reposting those particular bills.
One moment. The CA's got something here. Well, so Representative Heinzman, that may well be necessary. As I said, we did get information I'm happy to send to you from House Research that's indicating they thought that it should be fine, but it may well be that just to be on the safest side, we do exactly what you're describing. And I appreciate you bringing that up. And as I say, that language in particular would end up in a division report regardless, but but if that ends up being a concern, I would certainly think that we could do that. So let's, if we can, send you what House Research had to say about it, you and staff, and then it may well make some sense to do that. But I appreciate you raising that now. So anything further on that, feel free.
No, I just think that would make a lot of sense to go ahead and revisit those things. As folks know, we take a lot of pride here in doing things by the book, and that avoids legal challenges and other issues down the road. So I thank you for that consideration.
No, and thank you, Representative Heinzman. And I guess my only hesitation is only in that we also, in general, the House Research tends to be, and I know they don't like being put too much in that position, but generally, sort of like as they describe things, we go along. But I'll send it to you and we can take a look, but it may well be that what you're describing makes sense, and I do appreciate you raising it. Any other issues from members? I'm not seeing anything. So at that point, we will adjourn, and many thanks to members for coming back for your patience today.